Hi everybody, I'm Chris Willis, the Dietitian and Diabetes Educator for OSF St. Mary Medical Center here in Galesburg, Illinois. I got started, I've been doing this I just had my 30th anniversary, work anniversary. So how I got really started in it was basically through my athletics in college and taking a nutrition course and realizing, hey, that's gonna be something that's gonna be worthwhile pursuing. So that's where I got started on the nutrition and dietetics part of it. The favorite part of my job would be interacting with people, getting to play with plastic food all day long, getting to teaching people about good nutrition. I have lots of different aspects of my job, so that's the nice part of what I do. I have a variety. I see patients in the hospital, I see patients in the community, or people in the community. So I do a lot of different things. So I don't have really one favorite, although I have to say I do tend to favor the diabetes part, because I did, go on and get my certification to be a certified diabetes educator, which took a lot more education, a little more time to do. But again, it's probably my little passion on the side. That's probably the best part of my job, is the diabetes aspect. So the elderly population face, I think, a multitude of challenges that I think that you recognize, or most of the individuals I may be talking to recognize. And I think a lot of it has to do with, insurance, no insurance, cost of medication is always an issue. You get into, sometimes cognitive issues or memory issues. So that's why I also encourage any of my older individuals that are coming in to see me, please bring a family member with you, someone else that can help support you and hear what I have to say, to ensure that you know what you're doing. Maybe there's some chewing problems or swallowing problems that are starting to go on. So the quality of their food, and again, monetary issues, what's the availability, what am I able to afford, what cooking, who wants to cook for one person, let alone two people. So that's why it's nice, when you're in the assisted care facilities, to have that food source coming in, and that's one less thing you have to worry about, for sure. Your ability to walk, or your stable gait, are you having to be immobile? Those are things that affect your nutrition as well. Certainly the biggest thing as we age is the loss of muscle mass. And so there's a big push for us in the dietetics community to push more, if there's no kidney issues, of course. Protein tends to be probably the least consumed food group for the elderly population. In protein, again, for all those issues mentioned before, maybe it's a chewing issue, maybe it's a financial issue, but they're not getting good sources. And so as we get older, our muscle mass starts to decline, and the more protein we have to help stabilize that protein mass can help with safe gait, balance, and strength. So the diabetic patient is old, again, they can have a whole host of those issues I just mentioned earlier, but now on top of that, they have blood sugar involvement. And so we have issues such as high blood sugars that can occur, and we have those that I think the hardest thing for the elderly population that we're concerned about is what we call hypoglycemia unawareness, or those that are on certain medications that can create a low blood sugar. So in other words, they're tending to have lower blood sugars and not be aware of it until it's too late, and that can be a danger. Of course, if you're in the assisted care facility, you've got access to immediate medical attention for that. Those that are at home, not so much. So I think the instability of blood sugars can be certainly a daunting issue that we need to try to stay on top of with our older population. And if possible, we like to set them up, especially if those that are on insulin therapy, because insulin is the hormone that regulates our blood sugar, but some individuals don't produce enough of it, so they have to inject it. So those that are on insulin therapy are the most prone to having low blood sugar reactions, and need to have we need to be aware of that. And one of those things that we can utilize for them, hopefully, would be what we call a continuous glucose monitor, which can be attached to them on their arm, and can give the staff or the family members or the individual themselves, of course, seeing the trends in their blood sugar. Are they starting to run high? Are they starting to go low? And how can I correct that? It is safe to go to your physician, but I think also you have to look at the fact that telehealth or video is probably of primary importance, but it can't replace that one-on-one, that face-to-face, or that physical exam that a lot of our elderly patients need. They need to have their feet looked at if they're not doing it themselves, because there could be issues going on there. We want to make sure that they're seeing their doctors regularly and having those checkups so that we can prevent those. So I think probably the most successful tip, number one of primary importance, is again taking the medication as prescribed, and highly recommend blood glucose monitoring. That's going to help keep those individuals. Unfortunately, I know finger sticking, nobody likes to do that, but finger sticking, if you don't have the continuous glucose monitor where you don't have to finger stick all the time, is important to stay on top of what you're doing. Trying to plan out healthy meals, using your information that you might have obtained from one of your educators or your physicians. One of them I use is the healthy plate. Just a reminder or a visual of, really what we're trying to get you to do is to continue to try to eat healthy. Don't rely on a lot of takeouts or fast foods, if at all possible. Trying to maintain good nutrition is really, really important through COVID. The importance of getting your greens, leafy vegetables in, half of your plate with your veggies, a quarter of your plate for your starch or your grain food group, the other quarter of your plate for your protein. But just keeping that kind of eating style in mind and trying to be consistent with that. The milk is in there if you don't like milk. There's yogurt if you don't like yogurt or milk, or if you can't tolerate it, there's other dairy sources out there that you can utilize. And if not, discuss that with your provider, because you probably need a vitamin D or calcium supplement. And of course, down at the bottom, you can see the orange for the fruit. So the fruit food group, whether it's canned, I don't care. Canned, frozen, fresh, it's whatever you like. I like those little packs, you can just whip those things open and they're easy. I think fruit is probably one of the missed food groups for that population, in addition to the protein. Think of protein packs like your tuna comes in those nice handy little foil packs. You just rip them open, you can just eat them right out of the foil pack. Even cottage cheese is a great protein source or a good snack, thinking of snacking items. I try to get everybody, not just this population, to try to keep the junk food out of the house, because guess what we're gonna do if it's there? We're gonna grab that bag and we're gonna sit there and we're gonna stress eat, right? So, which is okay, but I would much rather you stress eat on a can of green beans than on a bag of potato chips. So it's just challenging, I know, finding something to do that's physically. Do some chair exercises. Can you, walk up and down stairs if you're stable? Can you, take 10 trips around your living room during commercial breaks? Can you think of activities that you can do that keep you somewhat moving rather than sitting idle during this time? And for Pete's sake, if you're able to get outside and walk, that's probably the best thing that you could probably do. Currently support group wise, obviously with COVID going on, there are none. I do know at this point in time that there's 2 established support groups going on for diabetes. One is in Monmouth and one is in Kewanee, so you could always get a hold of those hospitals there. They could give you more information in respect to that. Otherwise, you're talking about, going, if you use online stuff, you can always go to the American Diabetes Association website and find out some more information or local resources for you there. I think if anything, call your healthcare providers as well. If you have any questions anytime, I'd be more than happy to field your questions. If you want to just call out St. Mary's Hospital and ask for the dietitian, they'll connect you to my office and leave me a voicemail, and I will get back to you, I promise.